Welcome back, everyone. I hope you all are feeling energetic and geared up for a couple of more engaging sessions. I would request everyone to kindly switch on your videos if your bandwidth allows, and also ensure that you are on mute unless you wish to speak anything to avoid any disturbance. Also, I would like to mention for the participants who have joined us a little late to kindly share their name and organization's name on chat section. It would help us to keep the track of your attendance. Now, moving ahead, I would like to invite Mr. Prosper to take up the session on snapshots. Over to you, Mr. Prosper.
Thank you very much for the opportunity. I'm just going to share my screen now on the presentation we have today. So can you see my screen?
Yes, it is visible, Mr. Prosper.
Okay, so for snapshot of what we do in Nigeria, we have the, my name is Onyekachukwu from Nigeria. I lead the ECHO project in Nigeria. And with me are some of my colleagues here, Marian and Joy, and others that are connected remotely. So we'll be looking at introduction to HIV ECHO in Nigeria, then benefit of HIV ECHO in Nigeria, application of ECHO in Nigerian HIV training. We also look at number of HIV ECHO program in Nigeria, and then we look at how participants join the program, then ECHO success story in Nigeria, then our feedback for questions and feedback. This is the guideline that was given to me, and the presentation is prepared accordingly. So HIV ECHO in Nigeria is about using virtual platform to build the capacity of health workers to provide better health HIV care, treatment, and service.
Sorry to interrupt, Mr. Prosper. If you could able to, on the slideshow mode, will be.
I can hear you. You said?
I'm saying if you could able to do the slideshow mode of your presentation.
Oh, yeah.
It would be much better.
Yeah, so I'm just giving HIV ECHO in Nigeria is about using virtual platform to build the capacity of health workers to provide better HIV care, treatment, and service delivery to PAL HIV, and share global best practices among healthcare professionals. HIV ECHO in Nigeria started in 2007. The ECHO project was piloted in 2017 up until 2018 at 11 PEPFAR supported sites in Nigeria using video conferencing technology. And the pilot project was concluded in 2018. However, University of Maryland, Baltimore, the organization that was leading the ECHO project program, kept on supporting the data session till the end of 2019. But in 2020, CDC awarded a new grant to UMB and mandated all the implementing partners to get their facilities on board. This continued, but in October 2021, Phase 3, which is the organization I'm working with at the moment, took over the implementation of ECHO, and it was relaunched in May 2022. We christened it to SPICE ECHO project, which is further broadening the program area beyond HIV care. HIV ECHO in Nigeria continued, and HIV ECHO in Nigeria is designed to build the capacity of health workers for the care, treatment, and management of PL-HIV. Currently, we have a number of participating health facilities, over 696 facilities, and this happens every week. And this has been consistent since 2000 and since 2020 March, when CDC relaunched the funding. And then we have about 6,092 individual participation on a weekly basis. Then the targeted audience are all the individuals that interfaces with the patients from time of initiation into care to exit. And that includes the nurses, the counselors, pharmacists, doctors, lab scientists, record staff, among other healthcare providers. In Nigeria, although HIV care and management were the original targets from the onset of when the ECHO started, but we are currently covering other non-communicable diseases in special ECHO sessions. We usually have special ECHO sessions that we could delve into other non-HIV diseases. ECHO is currently active in all the 19 supported CDC states in Nigeria. And then we do a yearly curriculum development covering different areas such as key population, lab, care and treatment, CQI, prevention, counseling, pediatrics and adolescent care, among other program areas. Then looking at facility average participation from October 2021 to date, phase 3 took over in October 1, 2021, and we have actually done some level of improvement significantly, as shown in the graph on the average from October up until date. We have had significant increase in participation across all the supported facilities. Specifically, there has been an upward trend in facility attendance over the past 9 months. And then in the month of March was when we recorded about the highest participation, highest individual participation. Now, what are the benefits of HIV ECHO as requested? During the COVID-19 lockdown, ECHO, it was used for the training of incident managers for COVID-19 responses across the country. That was when everybody was seated at home, and then incident managers needed to be trained, and there was no way we could get across to these people considering the social distancing and the lockdown that affected everybody. So this ECHO was used to do that training across the incident managers in the state of Nigeria. It was also used to provide technical support for enhanced sites monitoring, ESM, in all the CDC supported states during the COVID-19 lockdown. So this was what the IP is used to monitor the ALT activities and patient participation in terms of picking drugs, and also every facility on ECHO call on this weekly meeting, ESM meeting, will come and give updates of what each facility is doing with the patients, how many people are still on treatment, how many are lost to follow up, how many are given maybe multi-month dispensing, among other related concerns, and then funders are taking notes. Then we also have bi-weekly PEPFAR ALT program in the context of HIV, context of COVID-19 by Dr. Ted. This was also another further expanded training and monitoring that we are trying to find out the activities during the COVID-19. Part of the benefits also, it fostered the setting up of WER in collaboration with 5 West African countries, including CDC, NCDC, and MPHCDA. So West African Regional ECHO is came after we've consistently run the traditional ECHO, which is what we call Spice ECHO, that happens every Thursday. And now during the COVID-19, there was need to further engage the West African region on the COVID-19 care and management and all of those involved. So that's how we're thinking about. And other benefits include weekly learning of new approach for care and management of HIV and AIDS. So this has helped to train health workers on a weekly basis on new disease area, new program management, HIV co-infection, TB, HIV co-infection, among other areas that the facility needs to learn. This is on a weekly basis, and facility participants has attested to the new knowledge they gain on a weekly basis through this ECHO platform. Now, special ECHO session on needs and demands. So at times CDC may need to pass some information, maybe during the advent of, during the Lassa fever outbreak or during the monkeypox outbreak, and they needed to communicate or provide special training to facilitate. They use ECHO platform to, do that, and then be sure that all the facilities in Nigeria will be in participation. Then we also have what we call monthly facility case presentation. This is the idea or the new innovation from the current organization handling ECHO, whereby we have a case presentation, giving the facility the opportunity to present cases they have successfully managed, or they are currently managing, or they have challenge in managing. So the implementing partners, the 4 implementing partners in Nigeria, take turn to make a presentation. They will just call any of their facilities in any of the states to make a presentation on case management. So these are just a synopsis of the benefits of ECHO in Nigeria, among others. Now, application of ECHO in HIV training. We have talked about weekly learning for health workers. That is continued capacity building of healthcare workers in different areas of HIV care and management. Also, it has helped in standard practice. It has helped to bridge gaps in medical knowledge and ensuring no variation in practice across board. Now, the caliber of subject matter experts we have on the ECHO platform gives the participant the opportunity to learn direct from experts. What happens in maybe the best hospital in Abuja is also what's the knowledge that is being transferred to the list of the hospital in rural area or in hinterlands. Then on monitoring, we have also, this has also helped to inform monthly engagement of at least one treatment site to showcase their experts in service delivery to their clients. Then community learning. The application of ECHO in HIV training has also helped to establish cross-coordination of knowledge across the West African region in the care, treatment, and management of emerging diseases within the region. Now, we have the SOP. It also provides strategic guidance for COVID-19 response across West African region. Now, part of the request was to talk about the number of HIV ECHO programs in Nigeria. So currently we have 2 ECHO programs in Nigeria. The first is the Spice ECHO session, which happens every Thursday at 10 a.m. West African time, and involve all the facilities that provide HIV services in Nigeria and beyond in 19 states supported by CDC, and other non-CDC supported states also join the platform, but we are only reporting according to the fund, CDC is funding us. Then the second one is the West African Regional ECHO session, where this happens bi-weekly, every Tuesday bi-weekly, 2 p.m. West African time, and the focus is on COVID-19 intervention and response. It's a consortium involving the Nigerian Center for Disease Control, the US Center for Disease, NPHD, that's National Primary Healthcare Development Authority, and 5 other West African countries. And then how participants join the program, we have a dedicated Zoom link that participants use to join the session. Participants are expected to join in a group from their facilities where each ECHO equipment has been set up. So we encourage group participation in all the facilities where we have set up. Then individuals from implementing partners and other healthcare workers also use their smartphone and iPad to join the session if they are not together in a setting. And then we also have the subject matter experts and the panelists who also join from their various locations. So the panelists here, when we have the presentation, facility case presentation at the last Thursday of every month. We have been very consistent on this. We usually involve panelists like professors and those that are directly concerned with the topic of the day to provide further perspective to the facilities after they finish presenting. The panelists will either put them through where they make mistake in the management of this particular case, and then they draw inference. Then we also have the Federal Ministry of Health, the State Ministry of Health, and implementing partners also joining from their various locations within the country. Now, eco success story, we had to add this because we have actually recorded quite a lot of success since we took over and since eco implementation started in Nigeria. The first here is paradigm shift. Project ECHO has greatly changed learning paradigm among health professionals in Nigeria by creating unending demand for new knowledge. This, every week we spice up what we do because across the scope we have, including treatment, KP, QI, MIE, among other areas. So there is unending demand from participants on what do we have this week. Maybe we are going to learn something new. So it has created this demand. We also have case presentation. I did mention here that health facility use the platform to case their work during case presentation. This is done last Thursday of every month. Facilities will present. So it has helped to give them sense of belonging, that they are showcasing the great work they are doing. A facility can be chosen from the least rural area that have probably managed a very delicate case successfully, or they are having challenges in managing it. So they are given the opportunity to present. This has further increased the participation. And then, of course, when, for instance, a certain IP is presenting, they will want all their facilities to be on the call that day, or probably when a certain IP is presenting and they're presenting on a very interesting case, everybody will want to see how was this case managed. And we have the engagement, which is the implementing partners utilizes this platform to monitor the engagement of their supported site. So implementing partners are always on the call to manage or to look after what their sites are doing and follow up accordingly. Now we have on the community. It has been the biggest virtual community of learning platform adopted by Federal Ministry of Health and US Center for Disease to reach out to healthcare workers. So now, Federal Ministry of Health has adopted this platform and have mandated all the states and all the facilities in the states to join. So we see that we have grown communities that are learning every week, learning new things, learning guidelines, learning principles on care, treatment, and management of HIV and AIDS patients. And then a unified program. It has also unified program implementation, learning, health, treatment, and management of HIV in Nigeria among IPs, health facilities, State Ministry of Health, Federal Ministry of Health, and PEPFAR. So we have a unified program. Nobody is implementing. We don't have a kind of disintegrated program implementation. Everybody is doing the same thing because it is a unifier. And let me use that word. So this is a little bit of the ECHO success story in Nigeria. So thank you very much. I will sit back and take questions and concerns if there is any. So I want to hand over back to the moderator. Thank you very much.
Thank you, Mr. Prosper. If anybody has any questions, kindly please feel free to unmute yourself, or you can also use the chat feature to post your questions or any comments. All right. If you do not have any questions for right now, you can always keep the chat feature to post your questions. Now, moving ahead, for our next session, I would like to invite Ms. Aanchal Chauhan from Trainings team to take up the session on facilitation basics. Over to you, Aanchal.
Thank you, Himanshi. So this session is focused on the facilitation bit. So if I have to correlate it to, you can consider the discussion we've had when we were talking about the different roles that the hub team can play. And we did talk a little bit about facilitation also over there. I'll quickly just share my screen. So for this presentation, we are going to focus on the role of a facilitator from the beginning till the end, how to moderate between the sessions. We did talk about the importance of facilitation and how facilitation can enable us to have interaction and conversation within the session. Now, the learning objectives over here is to recognize the responsibilities from the facilitator's point of view in TeleEcho session. We are going to further talk about some techniques that can create a welcoming environment for the participants, to create learning for a diverse group of people using the video conferencing platform. And lastly, we have the important elements that how to encourage the participation. Now we ask, I would open the platform and I would request everyone to think back of the last meeting that you attend. It can be anything, it can be functional, it can be dysfunctional meeting that you have attended. And what did you think that it went smoothly or did it not go well? And why did you feel so? So I'll just stop my screen over here. So any one of you would like to answer to that question, feel free. You can share the comments on chat. You can also unmute yourself and share your experience of the last meeting. Or maybe the question was too specific if we have to recall a specific meeting. We can rather focus on some of the good attributes that you could focus on any of from any of the facilitators of any of the session, or some of the let's say bad practices that they might have practiced which could have discouraged the interaction in the session. Anyone who would like to go ahead and share your observations of the session? Okay, so Dr. Melinda has mentioned that she missed the question. So what I'm trying to ask is if you could recall any of the sessions or last meeting that you attended, how was the facilitation there? Some good practices that you noticed, some bad practices that you might have noticed, or some aspects that you feel like that if facilitator would have could have done this in order to have more interaction, or from the facilitation point of view? No. It does not have to be echo session, or it can be any random meeting that you attended in past, or any of the trainings that you have been to. Yeah.
Can I add?
Yes, please go ahead.
So what I usually find somewhat frustrating is when the facilitator starts off with a very problem-oriented approach. So I think people respond better if the facilitator is solutions oriented. So instead of focusing on what the problem is, what the difficulty is, to try and find solutions, because there's always going to be problems. You know, there's always going to be challenges and negativity. But if the facilitator is trying to gear everyone towards a more solution focused orientation, then it usually makes the meeting go or the discussion move a lot better and a lot more positively.
Great. Thank you so much, Dr. Claudine, for sharing that. Correctly mentioned. So if we have a facilitator in the session who themselves are not able to focus on the positive aspects of what can be done, or let us say, everyone over here is joined in the meeting in order to focus on the solutions and rather prioritize and focus on the negative aspects of the discussion that is going on, it does somehow brings down the energy of the session. Also, it kind of give away the message that, okay, there is a possibility that nothing what we try to do is going to give us the right solution for it. So great suggestion. Thank you so much. Melinda, Dr. Melinda, please go ahead, unmute yourself.
Yes, so I really like it when facilitators are able to draw people out. So you sometimes you might have a few participants that talk a lot, but they're able to kind of direct the conversation and maybe get some of the more quieter people in the group to start sharing, you know, their thoughts and their ideas. So I always think that's quite a talented facilitator when they're able to kind of manage that balance.
Great suggestion. So yeah, very correctly mentioned. So to be able to have interaction in the session, and it has to be from everyone, because everyone that has joined the meeting or is attending the session is part of the session. And so they should also feel like one. So creating interaction becomes the integral part of echo sessions also, if we can consider. Also, I see Dr. Bruce has mentioned on chat, good practice, listen well to the participants, respond and only add as needed and not to be too repetitive. So yeah, maybe rephrasing what they said can be incorporated, but yeah, listening to them well, appreciating their response if it is something that the hub team or the other participants can also incorporate for their future learning. So then appreciation is also one more aspect. Yes, Dr. Dominic, you've raised your hand. Please go ahead.
Yeah, I think, are you getting me?
Yes, we can hear you.
Yeah, the session from yesterday up to now is very interesting, especially with us, the team who are in South Sudan, in Juba, very interested. It brings a lot of projects in my mind. In case someone or a group create their program which can be productively according to the program and the lesson we require from the ECHO project. Will there be any assistance or directive, or are you going to have a branch as a new team in South Sudan? This is my willing, because the way I started monitoring the program yesterday, very interesting, first time for us in South Sudan. So I don't want the program to finish just like that one tomorrow. So I'm expecting you to send the other team to come and get to put us in a way where we can push up worldwide. Thank you.
Great. Thank you so much, Dr. Dominic, for mentioning that. And for us also, even we want all our hub teams to attain to that level that we have aimed at. But slowly and gradually, once we understand our audience, our participants, how we can drive their attention, how we can create more interaction during the session, And of course, our main objective is to create learning, and interaction, we understand, is the core essence of it. So we will definitely guide the respective hub members, the hub teams who are planning to launch their program in the various ways that they need help, and will also guide how we can improve on the different aspects. But from my personal experience, what I would say is that it is over the period of time, once you start interacting, that you learn that, okay, if we have certain kind of audience, this is how we deal with it. If we have certain kind of issues that are coming in, this is how we can troubleshoot them. So it's a step-by-step process. It's a learning process that we are following. And it's not just the spokes that are learning. It's also the hub members who are planning their program and executing it. They are also learning it via experience. So very much on the same page. We also hope for the same for each and every hub team that has joined here. So maybe I can move ahead with the presentation. I have gathered some great responses from everyone, and I completely agree to that. And I will try my level best to incorporate that in the slides further. So when we talk about group consultation and mentorship, so a consultation is something in which the respective members, they are joining in, maybe through a video conferencing platform, but it's a one-time consultation. They are giving the recommendation